Mr. Rashaad Amra, who's a health economist, who's going to speak about understanding the fiscal space South Africa finds itself in the current period. We've just had the budget speech. We've had concessions from the minister to say there's allocation of budget, and let us see where we are and how much of that budget that has been tabled is assigned to the health system. So with that, can I allow you to come through?
Okay, good morning, everybody. Nice to see everybody here today. I initially came in this morning without slides, and an economist without slides is like a one-handed economist. He'll give you a correct answer. So let's proceed. I have some introductory remarks based on last week's speech, but it's more fiscal history to frame where we were last week. And the short answer is there isn't any fiscal space. But I'll elaborate upon that. So if we may proceed with the slides, thank you. Okay, so 2008 is kind of like where our fiscal history begins. 2008, we had a financial crisis. We had a significant increase in spending post-2008, but it really accelerates where some people call it the Polokwane moment, if you remember ANC conferences. So we have a growing gap between revenue and expenditure, which the late Tito Mboweni used to call the hippo. He always wanted to close the gap between revenue and expenditure. So this is kind of what happens with the financial crisis. We increase spending, we loosen the purse strings in certain respects to respond to slowing growth and increasing needs for the economy. But for revenue to grow, revenue is in blue over here, you need growth. Growth has been rather anemic in that period for the past 15 plus years. And so you see a growing gap between revenue and expenditure. Now, when your revenue is less than your expenditure, you need to borrow. Next slide. And so when you borrow, you're running budget deficits. You're borrowing according to your needs. And this is, if it's on the black line over here, you're balancing your budget, so to speak. What's very important to note over here is the primary balance. That's the difference between the revenue you collect and your non-interest expenditure. And so for some time, we were running deficits. This big drop over here, as you know, will be the COVID time, where growth slowed, but we also had to increase expenditure. And so we've been running budget deficits for a long time, and the effect of that is increasing debt now. Debt around 2008, at the time of the global financial crisis, was about 24%. It's increased precipitously to 2025, around 76%. Now, when you're increasing your debt, you have to issue debt when your revenue is exceeded by your expenditure. Next slide, please. You have to service that debt, so you have to pay interest on that. Now, debt is not a problem. Borrowing is not a problem. We have social needs. A country with such high levels of inequality and deprivation, we have to spend. But when you spend and you borrow, you have to service that debt. So in the year 2008, 76 billion rands went to servicing our debt. Last year, or the current financial year that's about to conclude, 420 billion rands goes towards servicing that debt. So the question for the Minister of Finance responsible for balancing or maintaining a healthy public balance sheets and public finances is how does he, or maybe in the future we'll have a female Minister of Finance, she manage the needs of society with managing our debt stock and is it justifiable that we spend 420 billion rands and sustainable 420 billion rands to service our debt, knowing that 420 billion rands could be allocated to something more useful, right? So public provision of goods. And to do that, you have to slow down your growth in your debt. So enter the period of fiscal consolidation. That is a fancy way of saying we want debt to stabilize the share of GDP. In the previous graph, you saw debt continuously increasing. The stated objective for the past 10 years plus has been to stabilize debt as a share of GDP. How do you do that? You need to reduce your deficits. I showed you those growing deficits over time. And to do that, you either have to increase revenue, decrease expenditure, or both, or a combination of the above. So government has been trying a combination of the above. I would say more biased towards slowing expenditure growth. And that's been the case over the past 10 to 15 years, is slowing expenditure growth Government has attempted to increase revenue through a increase in the VAT rate. Previously, last year's one didn't really work out too well for government. And slowing expenditure growth. The impact of this, and we've seen it in health, in education, in social protection, in policing, has been that the provision of public goods, the quality of it has deteriorated over time. Without a major refixing or reconfiguration of your service delivery model, slowing the expenditure growth means in per capita terms, the allocation actually slows or decreases once you account for inflation. And this has been fiscal consolidation, the path government has very vehemently, dog-headedly pursued with justifiable objectives, but really deleterious effects on the provision of public goods. So this has been the case, and government keeps on saying that next year public debt as a share of GDP is going to stabilize, meaning not increase. And this has been the promise for the past 5 years. Finally, in this year's budget, we actually have a credible path, a credible outlook for debt as a share of GDP. This is in part because we're seeing strong performance in terms of revenue last year, and the growth of the South African economy is not as bad as it was. We had 4 quarters of consecutive growth. So government, and this is quite credible in my estimation, or our estimation, that debt will stabilize the share of GDP. And so maybe we breathe a sigh of relief. Debt as a share of GDP is about to stabilize. Does that mean we have more fiscal space to continue spending on health, on social provision of social grants, policing, and education? No, government has changed the fiscal objective from consolidation to debt reduction. And this, I haven't seen much narrative in the public on this. Now, this means the implication of this, and this needs to be contested quite strongly in Parliament, whilst the objective is understandable, important, and necessary for the economy, the implication of this change in fiscal objective is that budgets are going to be constrained for the next 7 years for them to realize this debt as a share of GDP. So we thought we're going to have a plateauing of debt as a share of GDP, but no, government wants to reduce or has proposed a reduction in debt as a share of GDP over the medium term. The short implication is that stronger primary surpluses, meaning revenue less non-interest expenditure, needs to be even larger for us to realize that path over the medium term. The implication of that, despite there being a 4.3% increase in the allocation for health this year, which is stronger than other line departments and other services, is that this is we're not going to be finding much space for provision to grow faster than inflation and population growth. So that's the short context of the 2026 budget. One anecdote is we never had any increase above inflation to what we colloquially refer to as the syntaxes, that mean alcohol consumption and smoking. And the outlook, therefore, is one where there isn't much space. Sorry, are we okay? And that's kind of my contextual slides, and we'll like to move on to the conversation.